Now to the best parts of this class. Now we'll all go into on arrhythmias, which the whole second test is a lot about arrhythmias. And arrhythmias are any condition of the heart where, again, it's looking at EKG, and it's any condition where it's outside of a normal sinus rhythm. Normal sinus rhythm. Now, normal sinus rhythm, what does that mean? That means the SA node is beating regularly at 60 to 100 beats per minute. That pretty much looks like that. Or normal sinus rhythm is just SRN. Said that wrong. But that's a normal sinus rhythm. Beating normal, 60 to 100 beats per minute. You have a P wave, you have a QRS complex, and you have your T wave. This is your normal sinus rhythm. Now, anything outside of 60 to 100 beats per minute, or anything that does not look like this, is called an arrhythmia. Arrhythmias can be either benign, which means they're completely harmless, or they can be malignant, which means check them out. Or sometimes they can even cause cardiac arrest, and that's the first sign, and clearly that's not a good sign at all. That's very devastating. So you, like whenever someone has a heart condition or the lack of blood flow or a clenching feeling in the chest, you would hook them up to an EKG because you can tell a lot of conditions of the heart by looking at EKGs based on arrhythmias. And now, two basic arrhythmias I'm sure everyone's heard about is if your heart rate is slower than 60. So if your heart rate is slower than 60 or if it's above 100. If it's slower than 60, it's a condition called bradycardy. If it's above 100, it's called tachycardy. These can be considered benign or they can be pathologic, which means they're caused by a disease. If your heart rate's below 60, we went over this, bradycardy, exercise, increased vagal tone, that's what happens. You sleeping, increased vagal tone, your heart rate is low. Tachycardic is usually when you're exercising, your heart rate's above 100. So they can be completely normal. Now, what causes said arrhythmias? Now, pinpointing the exact cause of arrhythmia is pretty impossible because the body is very, 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 very complicated, and it's very hard to pinpoint one exact cause to an arrhythmia because anything can happen with the heart. The electrical system can do whatever the hell it wants to do. So it's very hard to pinpoint an exact cause. But again, over hundreds and hundreds of years of study, it's been shown that most of these things cause arrhythmias. It's either one of these causes. I know there's a cool acronym you can just memorize, and it's pretty much everything. Now, I just memorized the acronym. The acronym is called HISDIBS. Now, most arrhythmias are caused by these conditions. The H stands for hypoxia. Hypoxia means lack of blood flow. Remember back to the video where you stand up really fast, you have a lack of blood flow to your brain because all the blood rushes down to your legs. That's a version of hypoxia to your brain. Stroke isn't really hypoxia. Stroke is more of ischemia, hypoxia is lack of oxygen. Hypoxia is lack of oxygen to a certain organ. I'll explain ischemia. Ischemia is lack of blood flow. Lack of oxygen. But they kind of go hand in hand because oxygen's in blood. So if you have lack of blood flow, you probably have lack of oxygen, vice versa. But hypoxia is lack of oxygen to a specific organ. And over time, if a specific organ does not have enough blood flow, it dies. And if the organ doesn't have blood flow, this is talking about the heart. If the heart has a lack of oxygen, hypoxia, it gets really, it's not happy and gets really restless. And it lets you know that, and you start having pain, and you start having weird electrical signals and certain arrhythmias. So hypoxia can lead to it. The I is the one that I like, that I was using, is ischemia. This means lack of blood flow. Now, of course, if you have a lack of blood flow, you have lack of oxygen because oxygen's in blood. But ischemia is lack of blood flow to an organ. Mostly the heart. Lack of blood flow to the hearts, since we're talking about arrhythmias. This is what, I'll talk more specifically what a cardiac arrest or a heart attack is, what it exactly is, but it's essentially lack of blood flow to the heart. Over time, if the heart doesn't get enough blood, like for a specific time, it actually dies. Part of the heart dies, it goes in necrosis, which means it dies. And once part of the heart dies, it doesn't come back. It's impossible to come back. That's why when someone has a heart attack, they're usually affected for life, and there's really nothing they can really do. Well, obviously, you can make the other part of your heart stronger, but part of your heart is dead. So ischemia is lack of blood flow. If your heart has a lack of blood flow, it really gets not happy, and you'll start having side effects, and you'll start seeing things in the EKG. S stands for sympathetic. Sympathetic is the fight and flight. Spelled completely wrong. But that's the fight and flight. It increases your heart rate, increases your contractility, increases the activity of your heart. This is mostly exercise, increases your heart rate. We know that. That is benign, obviously. Also, excitement, fear, emotions, whatever. Caffeine, alcohol. Not really those, because they're not really sympathetic. But these things increase your heart rate. We know that. If you exercise, if you get excited, if you're really scared, you increase your heart rate. That also causes arrhythmia, causes tachycardia because you increase your heart rate. And then you have, and the D stands for drugs. That's obvious. Drugs mess up the heart, and they cause certain arrhythmias. Now, the ironic thing is mostly they're talking about anti-arrhythmic drugs, such as some reason I can't think of any right now. Atropine is one anti-arrhythmic. Epinephrine isn't really anti-arrhythmic, but it is a cardiac drug. So these drugs are supposed to prevent arrhythmias, but they do more harm than good. Well, actually, they do prevent arrhythmias, but they cause another arrhythmias, it seems. It's a condition of like drugs having side effects, which is stupid. Also, cocaine and alcohol, caffeine, there's all drugs. So they're going to have obviously side effects on the heart, and there'll be certain arrhythmias. The E stands for electrolytes. If you have an imbalance of calcium or imbalance of magnesium, too much calcium, too much potassium, not enough potassium, whatever, the heart gets restless. Because since the body is an electrical system, it requires like an inflow of calcium, inflow of potassium, outflow of sodium, all that stuff. It requires a balance of electrolytes. Well, if you have an imbalance, you have certain conditions, and your heart would not be happy. And that's actually just a little fun fact, a lethal injection, like in a cell when they give someone a lethal injection to kill them instantly, what that actually is they inject them with a shit ton of potassium. If you inject someone with a lot of potassium, it messes up the heart's electrical system, because remember, from action potential, potassium is mainly inside the cells. It has to flow out and whatnot. Well, if you give someone a lot of potassium, they have a lot of potassium outside the cells, and that will mess up the electrical system. The system wouldn't know what to do. It can't contract any normal, and they die, essentially. So, fun fact, if you ever want to give someone a lethal injection, inject them with a lot of potassium. I didn't say do that. But that's what a lethal injection is, so electrolytes do that. The B stands for bradycardy. Bradycardy means a slow heart rate. Slow heart rate below 60. That's the criteria. That's bradycardy. That's just increased vagal tone. The S stands for stretch. That's ventricular hypertrophy, atrial enlargement, whatever. There's really not a definition. Stretch, strain. I don't know. It's a dumb definition. Can't really define that. But that's what most arrhythmias are caused by. His dibs. His dibs. His dibs. Hypoxia, ischemia, sympathetic activity, bradycardia, electrolyte imbalance, drugs, and then stretch and strain, lethal injection of potassium. So these things cause, most arrhythmias are caused by certain things, such as these. And basically, normal EKG is perfect, beautiful. Arrhythmia is anything outside of normal sinus rhythm of 60 to 100 beats per minute. That's a perfect normal sinus rhythm, 60 to 100 beats per minute. Anything outside of that, whether it's slower, faster, not correct, or the rhythm's not like this, I'll start showing pictures of other arrhythmias soon, or I'll show you videos, and you can tell they're arrhythmias, it's not normal, because you have like, here's like a perfect thing, obviously not a good drawing, but perfect. Okay, maybe not perfect. Like one arrhythmia before a heart attack, arrhythmias can look like this. That's not good. That's a VFib. Can look like this, to a side to point. Okay, maybe not like that. But you also have arrhythmias that you got a normal P wave, and then you got strain like that. That's a real arrhythmia. That signifies of a heart attack. So you have these different arrhythmias. They stand for different things, mostly outside of 60 to 100 beats per minute. Now we'll really quickly go over how to measure a heart rate on arrhythmia. Now you can measure heart rate obviously through radial pulse, but if the client's not in person, you can just look at the EKG and measure it. There's three methods. Now, the first method is called the big box method. What you would do is you look at the R waves. Okay, this situation has 4 R waves. and you count the big boxes between them. So here you have 1, 2, 3, 4. Yeah, well, that's perfect. So 4 big boxes. And then what you would do is you take 360 and you divide by however many boxes you have. So 360 divided by 4, I don't know, I do physiology, not math, so I really don't know what that is. But whatever that is, that's the heart rate. And obviously, if they're closer, say you have 2 boxes, 360 divided by 2, it's even faster. I actually don't think it's 360 now because that doesn't make sense. No, sorry, it's 300. So 300 divided by how many big boxes they have. Now, in this instance, they're not going to be this perfect. Like, this one's not really a perfect, but 1 box, 1, 2, 3, let's say 3.5. So 300 divided by 3.5. So it's about, this person's pulse is probably, let's see, 1, 2, 3, 4, 300 divided by 4. That's 70-ish, 5-ish. So this person is a normal sinus rhythm. The other method is called the small box method. If you can do the big box method, I don't know why we do a small box method, but it's the same thing. But instead, you just count the small boxes. And you take 1,500 divided by how many small boxes. So this person, you can just go 1, 2, 3, 4 big boxes. There's 20 in there. There's 4 small boxes to a big box. So there's different ways. Another way is with the rhythm strip. This rhythm strip isn't long enough to do it. But essentially, rhythm strips are divided into 3-second intervals. Like this one doesn't have any hash tags on it, but rhythm strip would be like this. There'd be little lines between it for 3-second intervals. And what you would do is you would take a 6-second interval looking at, and you count how many R waves, and you multiply it by 10. I don't have an example to show, but essentially that's how you would find a heart rate. But it's pretty easy to determine an arrhythmia by looking at it. I mean, clearly this is perfect. But if someone has a fast heart rate, you'll notice it. If someone's dying, has a heart attack, you'll notice it. We'll go over all these things later, but you'll notice it pretty much.